Alaikum everyone. Assalamu alaikum everyone. My name is Sophia Ansari. I am the president of the Muslim Women's Organization here in Orlando. And we are here today with a few of our members, MWO members, who have been working on the front lines of this COVID pandemic. We are here for a session on sisterhood, solidarity, and spirituality. Today, we're going to be highlighting the work that our frontline workers are doing. This is also going to be a fundraiser for the organization to support and continue to support all of the amazing things that the organization is doing. So you are seeing us on Facebook Live. Please if you have the ability, please do make a donation towards the organization to help us continue our work. With that being said, I'm going to go ahead and start with introductions. Today, I'm going to start with Dr. Annie Tarar. Annie, if you can introduce yourself.
Hi, everybody. Assalamu alaikum. I'm Annie. It's good to be here, and thank you for having me.
Wonderful. Thank you. Sorry. Along with the introductions, if you guys can share with everyone how you're feeling today at this moment.
I feel great, actually. I'm seeing lovely sisters without the mask and surgical caps on. I get to wear my earrings after 2 months, so it's kind of a party for me.
Wonderful. Thank you, Annie. Next, we have Dr. Dominique De Lorenzo.
Hi, I'm Dominique. I'm feeling very excited about this and glad to be able to meet with all of you and have some sisterhood. It's been a while since we've had an MWO meeting in person, so it's nice to reconnect with everyone.
Absolutely. We're missing that person-to-person contact for sure. Next, I'd like to introduce Rashida Muhammad, also an MWO board member. Rashida.
Assalamu alaikum, everybody. Thank you, Sophie. I'm excited. I'm happy to be we would say alongside the panel with everybody, but I guess alongside the screen with everybody. This is beautiful to be along just with all the sisters here. Alhamdulillah.
Alhamdulillah. Next, we have Dr. Sadia Ijaluddin. Sadia. Sadia, I think you're still muted.
Assalamu alaikum. This is Sadia Jalaluddin.
Uh-oh, we lost your audio, Sadia. Sadia, could you try again? We lost you on the audio. No.
Maybe try without the headpiece.
The headpiece. Okay.
Yes, that's better.
Assalamu alaikum. Can you hear me?
Yes.
Yes, now we can hear you.
Great. I'm sorry. My last name is a tongue twister. I know that you were trying to say my last name. Feeling blessed to be a part of this discussion, and I'm sure this discussion will help, with some positive discussion, and we can come closer as a community.
Inshallah. Thank you so much. And last but certainly not least is Rafat Ahmed.
Assalamu alaikum. I am Rafat Ahmed. I am a nurse practitioner. I feel relaxed today. I just came home after community COVID testing conducted by Department of Health and AMCC Community Clinic. So just got home, feeling relaxed. So good to see all of you. And thank you for having me.
Wonderful. Thank you, ladies, so much for being here. We really appreciate you being a part of this panel. The first question I would like to ask you all is if you could share with us what your role is in the front lines of the COVID pandemic, just so that everybody has a sense of what it is that you're doing. I know we have some people here on the medical field. We have some folks in the business field. So if you can share with us what your role is during this pandemic, how you serve on the front lines. And we're going to start with Dr. Annie Tarrar.
So I'm a primary care physician with Orlando VA Medical Center and an academic for UCF and Advent Health Internal Medicine residency. But since this COVID surge started, I actually volunteered to be detailed to emergency department to work with the surge planning and to see patients. And so that's, I think recently I had my best friend, she had COVID positive, and she was in Saudi Arabia, and I didn't know what to do. And after many sleepless nights, I decided that it's best for me to actually serve my purpose and volunteer in the emergency room to see patients. And I think I'm very blessed that I had that opportunity.
Alhamdulillah. How is she doing?
She is, alhamdulillah, doing great, and she's back to work.
Good. That's good to hear. That's a lot. That's scary, especially being in the medical field. Know that someone's so close to you, is experiencing that.
It was soul shaking, and given the fact she and I work the same kind of work and we have same work ethics, knowing myself, have done the same, and so I took an opportunity and volunteered to be in the emergency room, which is a little bit out of my comfort zone, but that's the call of the need.
That's amazing, Annie. Thank you so much. That's wow, that's very powerful. Next, I'll turn it over to Dr. Dominique De Lorenzo.
Hi, Assalamu alaikum. So I'm a family practice doctor with OB privileges. So I work in a residency clinic, and I mostly take care of women and children, but also just do general family practice. So we've had PUIs, and we've been doing testing in our office as well at Advent Health. And so it's a little bit concerning for me for my pregnant patients and my kids, because I feel like they're a little bit higher risk than some of the other general patients I take care of. And so I'm very always nervous about them and calling them to check in and see how they're doing. I take care of a nurse who's currently pregnant, and I'm always calling her to check in on her and just make sure that she's okay. And luckily she got redeployed. So alhamdulillah for that. So it's just been a little bit challenging in trying to, relax their fears as far as what's going to happen once they have the baby and the risk. And so alhamdulillah, I haven't had any, positive cases for the OB patients. So that's really good so far.
Alhamdulillah, that's I can't imagine. Being pregnant is already such a challenging situation. Like, I can't imagine having to go through it at this time. My sister-in-law just had a baby about a month ago, and I have a couple of friends who also delivered during the pandemic. And I just, it's a lot. It's a lot for your body to go through. It's a lot for, you to go through emotionally, that, having all of this pandemic craze and everything on top of it, and then not being able to be surrounded by your family because of the risks.
Yes.
I can only imagine, how difficult that is for new mothers, especially first-time mothers too. It's
exactly. Yes. Yeah, absolutely. For the first-time moms who have to choose between having their husband or their mother present or their sister, it's really challenging. So just trying to, relax all their normal pregnancy anxieties and fears, but then also having this has been quite a challenge. But they're really resilient. So
that's amazing.
It's been great to work with them.
That's amazing. Thank you so much, Dr. Dominique. Next, we have Rashida Muhammad. Rashida?
Yes. Assalamu alaikum, everybody. I'm a board member of the Muslim Women Organization. I'm also the owner of Haya Fashions and the instructor for the Young Designers Academy. And my mission during this time has been to make and design masks for our people on the front line, community members, family members. This initiative started when, I mean, very in the beginning, a little bit around March, I just saw that, you know, we were glued to the TV with the news and the shortage of the mask and PPE with all the, in the hospital, the doctors and nurses. And I just thought of, you know, like, what can I do, you know? And then when I saw that they were just, you know, not able to give all the frontline people what they needed, you know, I just felt like, well, this is something I can do. I can make masks. So alhamdulillah, with the help of Allah and my family, we were able to just start making masks. We started making them. We started donating them to Advent Health, Orlando Health, and community members. If I would go out and if I saw anyone without a mask, I don't care if it was at the Wawa or here, you were getting one. And at that time, people weren't really wearing masks that much. You know, this was March. You know, they weren't really wearing masks. You know, so we just really made it a point to, you know, get in where we can as far as our contribution. Like, what can we do to make sure that we can stop the spread? So that was our whole motivation behind that, because not only did we want to protect ourselves, but I mean, we can't protect ourselves if we're not helping to protect everybody. And so that's what we're trying to do. So.
Absolutely. Thank you, Rashida. Yes, you were on top of this whole mask thing well before they even gave out. I think I recall you making the mask before they even, you know, gave out the CDC guidance that the general public should, you know, start to wear them. So that's amazing. Thank you so much for that.
Thank you.
Next, we have Dr. Sadia Jalaluddin. Dr. Sadia, so tell us what your role is on the front lines of the COVID-19 pandemic.
So I work as an internist at Advent Health Orlando, and we see patients under investigation for COVID-19, and also we provide acute care and responsible for the discharges of the patients once they are optimally treated. And I, first of all, want to really thank Rashida, you know, how much important it is to have personal protective equipment at, you know, the facilities, because healthcare workers were at very high risk. Until a few weeks ago, there was a lot of fear and anxiety because we didn't know much about the, you know, condition we were dealing with. We did not have enough personal protective equipment, and that was basically causing a lot of anxiety among the staff that was palpable on a daily basis. So any little help that you guys were providing during these times was really appreciated. And you know, the biggest thing that I want to say, you know, the more we saw the patients with time, we saw the pattern, we became more comfortable with it. You know, we know how to treat the patients now. The anxiety is improving, and the treatment plans are, you know, the guidelines are more clear about how to deal with the situation like that. But at the times when we didn't have enough information, that was really hard. And the support from each other was a blessing. It was a huge blessing from the community, from the healthcare staff, for each other. That was the best thing I ever experienced in my life during you know, my career as a physician. So I really appreciate you all.
That's amazing. That's so true. You know, the way that people have come together during this pandemic, I think, speaks volumes to, you know, who we are as a community, and what we can give individually, you know, towards our community, and how we can step up. And like you said, Rashida, you know, figuring out and tapping into what you as an individual can do and how you can impact is huge. And I think there's so many people who have seen that it's a beautiful thing.
Yeah, I have one of my friends who delivered 2 N95 masks at my place. And I really, you know, appreciated her effort. She didn't know my size. It was large size. It wasn't going to fit. But I really appreciated the effort that she drove all the way to bring me some N95 masks, which I've kept them safely, used 2 of them. But that's a huge support that we need during these times.
That's amazing. Thank you, Dr. Sadia. Next, I'd like to introduce Rafat. Rafat, can you tell us about your role in the front lines?
Hello. So I am a nurse practitioner, and I'm also Seminole Action, MW Seminole Action Committee's chairperson. So I'm also very involved with MW as well. And as a nurse practitioner, I am credentialed at both Advent Health and at Orlando Health. And I work as an ER admitter. So that when the patients come in through ER and then when the ED physician decides to admit them, so I'm the first person who goes and meets them and just admits them. So I have had my share of COVID rule out patient and COVID positive patient, right? And just like Sadia said, especially in the beginning, there was a lot of anxiety and we were so overwhelmed and because the guidelines were constantly changing and then they were just constantly changing the medications, and all that. So it was a lot of anxiety. And then the staff, we were worried about the PPEs, especially in the beginning, when all this pandemic started, there was a big shortage of PPE in the hospital, right? We were all struggling to get the surgical mask. Even the surgical mask, there was a big shortage, right? We would get only one mask, and was really, really a struggle to get the one surgical mask. So thank you so much, Rashida, for donating to both of the facilities. I really, really appreciate that. And also for spreading the awareness. Like you said, that you were just whenever you see people at grocery store, convenience stores, and you're just reaching out to them and teaching them, how to put the face mask on and how important it is. Thank you so much.
Amazing. Thank you, Rafa. That's so true. I think the initial, the initial media coverage with regards to the shortage, I think was really troubling for a lot of people, and even just as someone who's not in the medical field, the idea that, my husband ordered masks from Amazon in February. So he was, he was prepared, he was ready. But even just, and they weren't N95s or anything like that, but I felt bad. I was like, well, do I, I called all my friends. I said, I have friends in New Jersey who work, in on the COVID response team. And I said, hey, do you need these? Because if you need, it's more important for you to have them than for me. And, luckily, alhamdulillah, everybody had what they needed, everybody who I reached out to. But also, from my perspective, I felt guilty having even just these, regular masks. Because I was like, let's make sure that the people on the front lines have what they need. So it's amazing, Rashida, thank you again for stepping up and filling that need.
I must say the situation has improved a lot. So hospitals I feel that they are better prepared now. We have enough PPE. So every day that we go to work, so we are not constantly scared and just because I remember, especially in the beginning, when we are walking into COVID positive patients' room, right? Some of us didn't have any N95 masks, so we were just working with surgical masks because, of course, it was proper precautions, and of course, CDC was suggesting that it's okay to use the surgical mask for the COVID-19 patients, but still it was a lot of anxiety was going on at that time. But we feel better, more relaxed, and better. Hospitals are better prepared now, and then providers are feeling better. So that's good.
Alhamdulillah. That's wonderful to hear. Now, I wanted to ask you guys, you're all in these very demanding work environments. How has Ramadan and fasting and all that comes with Ramadan, how have you been able to manage that with such a demanding, life in the emergency room, seeing pregnant patients, in a business situation? I mean, we talk about healthcare workers being, obviously in the front line, and school teachers and, grocery workers, business owners. The pandemic has brought on a lot of stress for all of these frontline workers, right? Both in the medical field and outside of the medical field. How have you been able to manage that stress, the work-related stress, and everything that comes with Ramadan and fasting? And we'll start this time with Dr. Dominique.
Alhamdulillah. So, for me, actually, to work during Ramadan is the easiest thing. To be home sitting around all day. I mean, I think that, it's really much harder to sit around in your house all day when you could be eating and opening your cabinets and all that, than when you're busy working. Because, alhamdulillah, when you're busy working, the day goes by so fast. So I'm actually really just grateful to have a job that I can be, working at during Ramadan. And because I know so many people, are out of work right now because of the pandemic. So alhamdulillah, it's just, I'm just thankful to Allah that, my husband and I both still have our jobs. And for me, like I said, Ramadan always goes by fast because of work. So it's not too much of a change there.
Alhamdulillah, that's so true. When I used to go to the office during Ramadan, it would go. You're so right. It goes by much faster.
Mm-hmm.
I definitely personally find that working from home during a pandemic, like like you said, I'm fortunate that I'm still able to work from home because not everybody has a job that they can do remotely. But the time is definitely slower when you're at home and managing work and the kids and the family and everything.
Mm-hmm.
But that's very true, alhamdulillah. Rashida, how have you been able to manage Ramadan and this COVID environment with work?
Well, it's been interesting. I mean, I was looking forward to the kids being in school, and I'm able to work because I have a work studio here that, my intentions were to be prepared for Fashion Week that was coming up in Beverly Hills.
Yes.
So all that's not happening right now, of course, but, my focus had changed to the mask making. So even now, we just got the family involved in the mask making. I mean, like we had my son's cutting, my husband's cutting, them teaching them how to use the sewing machine, just tiny little projects, not too much, just to keep them interested a little bit. But during Ramadan, the focus is more so on Ramadan. So now I'm trying to see how to keep the children busy, maintain sewing, cooking every single night when I'm used to going to the masjid every night. I look forward to that. So, but it has truly been a blessing because, I mean, I don't think it's been a long time since I have cooked for almost 30 days straight. So it's such a blessing and an eye opener, and it's teaching me ways to manage so many things, especially just managing family and family time and time to focus on Allah and just managing a lot of different things in many areas, but mainly in the focus of like, how can we grow and as a family and focus more on our faith. So, I mean, I have mixed feelings, but they're all great feelings. I would say that, but it's I feel like I'm doing something new or trying something new every day during Ramadan.
Alhamdulillah, that's amazing. Rashida, you mentioned the Beverly Hills Fashion Week. That was a huge thing, a huge honor. So, alhamdulillah, like it was such an exciting thing for you to be a part of and for Haya Fashions. Like, how do you, just kind of as a follow-up, like how do you reconcile that? I realize that there's a lot of, heavy things going on, and Fashion Week's not a heavy thing, but it's a big, for you in your line of work, that's a big thing. So how do you reconcile with the fact that this is where you were supposed to be at this time, and kind of how do you cope with that? How do you move forward?
I think initially it was on my mind, like, okay, so, in the beginning, it was getting pushed back. It was getting postponed. And I was like, it's not going to work. It doesn't seem like that is foreseeable. Like I couldn't see it still happening, even though like it was getting postponed. But I would say the coordinator of the fashion show, she just her energy level is just contagious. Like she's always excited. She's always optimistic about, you know, moving forward with the fashion show. So we all know that it's been put on pause. But, you know, what you said earlier was, you know, if that's where I was supposed to be, I had to really understand what's going on, and where I was supposed to be is where I am right now. Everything that is happening, that has happened, that cannot happen, the plans that were made, there's other plans now. There's other, you know, different focuses right now. And as excited as I was, and bringing along like another young designer who was graduating this year, Naima, her mom was gifting her a trip to Fashion Week to help me there. So those little things I kind of think about, like, wow, like, yeah, we did have plans, but, you know, alhamdulillah, we are healthy. We're here praying for other people that are not healthy, that may not have the opportunity to do that. So I try not to even think of it as any kind of a loss or anything. I think of it more as what I'm gaining now from just this experience, being able to, you know, listen to the doctors and their experiences, and the contribution my family and I made as far as masks. So the focus had shifted, and I tell you, I constantly just be like thankful to Allah for everything, and just even for this situation, you know, as it may sound.
Alhamdulillah, that's so true. You know, we plan, but Allah is the best of planners. And I think that's definitely something that's rang true through this pandemic. Thank you, Rashida. Next, we have Dr. Sadia. So Dr. Sadia, how are you able to manage a demanding work environment with all that comes with Ramadan?
Hard. Taking a lot of stairs, standing all the time, talking all the time, and wear a mask. That was quite challenging. But it's amazing to see that how after a few days our body adapts to the new routine and changes, and how our soul and body they are conditioned to the new changes. When the brain knows there's no food coming during the day, it eventually stops asking for it after a few days. So it's just amazing to transition to that form. And I feel like every time I walk in the hospital in the morning, I feel like it gives me extra strength, knowing that Allah is the ultimate sustainer. And now that I'm fasting, and I feel closer to Allah, and when you stop focusing on your body.
Sadia, sorry, we lost you. We lost the audio. No.
Me?
Sorry, guys. Technical difficulties. Sadia, maybe try it without the headphones. No, still no sound.
Can you hear me?
Yes, now we can.
I was just saying that when we stop, focusing on our body needs, we start having more spiritual growth. And that's what I have felt during this Ramadan. There was no distraction towards anything else. So it definitely helped me, a lot. And I thank Allah for that every day.
Alhamdulillah. Thank you so much, Sadia. Rafat, can you share with us about how your work-life balance has been with Ramadan?
So as with Advent Health especially, I work as a nocturnist. So my shift is usually from 6 p.m. to 6 a.m., right? So when I go start my shift, so we have only a couple of hours left for for iftar. So the rest of the shift I'm able to eat and drink till Sari, of course, right? So, but with Orlando Health, when I work at Orlando Health, so I'm working during the daytime. So, but the thing is that we are just so busy during the daytime, so time goes by so quickly. So before you know it, it's the end of the shift, right? It's just like, we're constantly busy. So, and the other thing is that's just like, I have noticed that it really, really helps with your spiritual growth as well, right? You're not focusing on food. You're just constantly working. You're just like but the only thing is that especially if you are fasting and working, and you are seeing COVID patients, and you are all gowned up, and you have mask on and N95 mask and face shield and everything on, you really get sweaty. So today I was working at I was actually volunteering with AMCC, and they have like some community testing going on. So today we were testing at this at the church, this Hispanic church. We were just we were in Oviedo. There's a church in Oviedo, and AMCC, along with Department of Health, they were testing for COVID-19. So it was really, so I went there today. I was there I was there at 9:30. So since 9:30, and the weather, of course it's outside, we are doing the drive-by testing. So it's outside, weather was not too bad. It was in 80s, but it was very, very humid. It was cloudy, but very humid. And I have this N95 mask on top of that, surgical mask on, and then we have the face shield and the gown and the, surgical cap. So you can imagine, how much PPE have donned on. And believe me, after a few hours, it was really hard. So I was sweating up, and the sweat was going inside my eyes, and then it was hard. So it gets hard, but alhamdulillah, Allah gives you strength, especially at this time, right? Yeah. Helps with your spiritual growth, like I said. So all good.
Absolutely. And, Rafat, I appreciate you sharing that with us, because, it's not always easy. It's not always easy to manage, work and Ramadan just on a normal day, when there is no pandemic, when there is no, when the whole world isn't on pause. So I think, we have to remember that it's, there's days where we can cope and we're just like, yeah, alhamdulillah, everything's great. But then there's days where it's not, and it's okay. It's okay to not have it together, and to not be able to cope on a day. That's why we have, mental health counselors. That's why we have our friends to rely on. That's why we have, a support system. And that's one of the things that at MWO, we really try to build is a support system, a sisterhood, a network. And that network, some of our programming that's ongoing during Ramadan and during the pandemic are things like session where you can have sessions with Amani Shalabi, who's our chaplain, where you can reach out to different counselors that have volunteered their time for MWO to have those resources available for the community. Because the reality is that it's not always easy, and it's not always within our capacity to smile and nod and cope and, have this cheerful face on. And we have to know when it's time to ask for help. And that's one of the things that at MWO we try to strive for, is try to provide resources so that the community knows, when a sister is in need and just needs a break or needs, a mental download, that she knows where to turn. So, it's definitely, I'm happy that you shared that personal experience with us, Rafat. So thank you. And now, Annie, same question. How are you, you're in the ER. How do you manage being in the ER and Ramadan and fasting? And that's a lot to ask.
So I'm going to continue what Rafat said. It's not easy having to wear an N95, a surgical mask, surgical cap, a bouffant, gown, double gloving, and to see patients all day. It's not easy. And on top, when you only sleep for a few hours a night, because you have to get up and make suhoor for your kids and your husband, and then you have to come back and do the proper spread for them for iftar. It's not easy, But of course, everything has a silver lining. And for me, it was a lot of personal and spiritual growth. Having somebody close to me getting the COVID, having lost people I know in New York, it was a life-changing experience. And I realized that a lot of things or a lot of problems I had was first world problems. This is a normal life for a lot of people living in Palestine, in Kashmir, in Syria. They don't have, they are in lockdown forever. So I think for me, the connection was amazing. That realization of the fact that we don't need a lot of things. We just need a phone call from a friend to cheer us up, or to see each other faces like we are doing today. So less is more. And I think I'm hoping and I'm praying to Allah that I continue with that lesson and continue to teach my kids. Being a physician, it's not an easy job anyways. You have to be a cheerleader all the time. At home, at work, you have to cheer your patients, you have to cheer your colleagues, you have to be the support system. But Allah subhanahu wa ta'ala has given us that courage, or has given us the strength, and I'm ever grateful for that.
Thank you, Annie. That's so important. You know, keeping it in perspective. You bring up such an important point. We're going to move on to our next question, and that is, you know, you guys are all a vital part of the Muslim Women's Organization. You've taken part in a variety of the programs that have gone on throughout the year. You know, Rashida, you're a board member. Rafat, you are the head of the Seminole Action Committee. You all have a very active role. So thank you for that. Thank you for giving of your time to the Muslim Women's Organization. We really appreciate it. We wouldn't be where we are without you guys. But I want to ask you now, how has your experience with MWO informed your work on the front lines? Is there anything that you've learned from your time at MWO, from events, from organizing, that has helped you through these challenging times? And we're going to start with Rashida.
First, I want to say I know that that you all had thanked me for my contribution and things like that, but as I watch, or actually not watch, like I'm on the phone with my sister every day, many times a day, who had battled COVID-19, as well as she's, alhamdulillah, she's much better, but her husband is now in critical condition. And as I listen, as I,
You okay? I know
I'm just, as I listen to all the work that you guys are doing, I know how hard it is, but I know how hard it is for her. And I know how hard it is for you guys to do what you do and then go back to your families. And, you know, just trying to make sense of it all, it can be kind of hard. So my sister doesn't live here. She lives in New Jersey. So, you know, for her not to be able to get with her husband or be there with him, or, you know, he's been in the hospital for almost a month now. So I think that, you know, what you all do is amazing. I wish I can be there with her. My mom wish she can be there with her. But MWO is just that. Like they call as an organization, as a sisterhood, you know, they keep in touch with me. They ask me how I'm doing, ask how my sister is, my family. And it's not that easy, but it feels good, It feels really good. And she's really the only one that I've known or came close to, that has hit home with me is my sister and her husband. So, I didn't really know all of you and, and all of your roles. I know Sister Rafa. I haven't met the other two sisters, the other two doctors. And just being on this, listening to you all, like, it can be, I know it's hard for you, but that's why I wanted to come on to the call, because this is solidarity. Like, this is what's needed, to see your faces, to get your input, and to, just to speak to another face of hope, So I know that you thank me, but I thank you, and I just ask that you keep my family in your prayers.
Inshallah, absolutely, Rashida. Absolutely.
I wasn't supposed to be doing all of this, like it just happened like that,
That's okay.
I'm usually like, pulled together a little bit, but it's real. It's just real. It's not a joke. It's real. And when you have sisters that call and check on you, or text you, ask, and that's the Muslim Women Organization. And many of my other friends and everybody right here in Orlando. And I've only lived here for almost 9 years. So I'm very grateful to be here talking to you all. And Sister Sadia, when you said earlier, just a level of, you were talking about spiritual growth, and that's what it is. And I hear my sister talk about that all the time, the strength that she has. The constant conversation is about Allah and forgiveness and mercy. So that's that.
Thank you, Rashida. Thank you so much for sharing that with us, and for, sharing the vulnerability. You say your sister's the only, your sister and brother-in-law are the only people who you know of who've had COVID, but that's your sister. That's like, I don't have a sister, but I know how close those bonds are. There's nobody in the world who could be closer. So when it hits that close to home, I think too, I would imagine that's what fuels you, right? Like, that's what makes you realize that this is real, and this is something that we have to work together with everybody in the community to overcome. Because if we're not all wearing masks, if we're not all coming together, if it's just Rashida wearing a mask and Sadia wearing a mask, but Susie and John and whoever else aren't, it's still, we have to work together as a community to overcome this situation. And I think that when it hits that close to home, you really realize what you need to do, and how it takes all of us to overcome this. So thank you, Rashida, for sharing and for being vulnerable. And we will keep your sister and your brother-in-law in our du'as, as we have been, inshallah. May Allah grant him a full and complete recovery, inshallah. Sadia, can you share with us what experiences have you had with MWO that you've taken to the front lines and have helped you inform your work?
All the ladies that I know who are in MWO, I really find them all extremely hardworking and inspiring women who are striving to make a difference in the community. And as a working parent, I can definitely relate to them for their,
Sadia, we lost your
and
audio again.
motivation to never give up. It's totally relatable. So I find them, I find their efforts are amazing, and I hope they continue to do what they are doing. and they are heard and acknowledged for all their efforts in the community.
Alhamdulillah. Thank you, Sadia. Rafat, you've been a very active member of the Muslim Women's Organization for some time now. Can you share with us about an experience that you've had with MWO or something that you have learned from the organization and from your work that you take with you on the front lines? Rafat, you're on mute.
Yes, Sophia, I am very proud to be an active member of MWO's Annual Election Committee, right? So I must say that MWO for me is the bond of sisterhood as well, right? So the organization skills that I learned from MWO, the communication skills that I learned from MWO, right? So on my side of town, I get to work with other organizations, right? Sometimes we do some projects that we do in partnership with other organizations, right? So that then sometimes I get to compare it with other organizations, right? So Alhamdulillah, like, MWO is always so organized, right? Communication is so much better, so much easier with you all. So Alhamdulillah, I'm so proud of it, right? So recently I've been before Ramadan started, I was involved with this care packages that we did it on the Seminole side as well. So I was working with Samina and with you, right? So we are just, the teamwork is amazing, Alhamdulillah. It's just working with you, Samina, Sadaf. It's really you guys can make the things that can look complicated. Oh my God, how are we gonna do all these packages, 180 plus packages? How are we gonna do it in such short period of time with all that fundraising? You guys make everything so much easier, Alhamdulillah, right? May Allah give you lots of jaza for that, right? You guys are very, very hardworking people, amazing leadership skills. Alhamdulillah, I'm very proud of that, right?
Thank you so much, Rafat. That's very sweet of you.
The other thing is that, of course, we have been doing some community projects with MWO, right? So I feel like that, on my side of town, not only with MWO, if, sometimes if other organizations, they need some volunteer work, like I was telling you before, this AMCC, American Muslim Community Centers, they have a free clinic. So when they ask me to volunteer for them for this COVID testing, right? So now, I've been working with MWO and the community, doing this community service. So now I'd like to offer it to other organizations as well. So I've been involved with this community testing. We have been doing it for this entire, starting from end of April, right? So this entire month, every Saturday, we have been doing this community testing. So that's the details I was giving you, that we are doing it in this hot and humid weather and all that. But Alhamdulillah, right? Yeah, I have learned all this, and I have so much thanks to give all of you, right? So I've learned all this from you guys.
Alhamdulillah. Thank you so much, Rafa. Thank you for all of the time that you've given to the organization. And I just want to piggyback on something that you mentioned, which is really important to the Muslim Women's Organization. So MWO initially started as a group of women who were trying to find ways to give back to the community. We are probably most well known for our care package program, our Eid gift program, our Thanksgiving Hope in a Basket program, and these are all community service programs. But in the last few years, the focus of the organization, the focus of the Muslim Women's Organization has shifted. We're not just a philanthropic organization. So we try to use these community service projects as tools to educate and train women so that they can go out, like you mentioned, Rafat, and do these type of projects within their communities in their areas of passion. So we try to give women the tools that they need to be able to go and do these clinics at AMCC, or do them at Jama Masjid, or do them at ISCF. Our goal is to give women who come out to MWO events and who participate in MWO programs the leadership tools and the training that they need to go out and be successful in any area of passion. So whether you're interested in environmental studies, whether you're interested in medicine, whatever it is that you're interested in, we want to give you the tools, right? And that's one of the very, very important things. So to hear you say that, Rafat, that you were able to take those tools and the things that you learned, doing the projects with the Seminole Action Committee and transfer those to another organization and to another area of your passion it's music to my ears. Alhamdulillah, like it's fabulous to hear that it's working and that it's happening and that these are our goals and we're actually meeting them. So before we move on to Annie, I just do want to interject, and for everybody out there who's listening and who's tuned in, these are the things that MWO is striving for, right? We're striving to give women in our community the tools that they need to go and do amazing things. So if you can, please make a donation to the organization. You can visit our website at mwo-orlando.org, make a donation to help us continue doing the work that we're doing. With that being said, Annie, if you could share with us, I know we have about 9 minutes, so I just want to do a quick time check. If you could share with us how your experience with MWO has translated into your work on the front lines, and then we'll have Dominique also answer that question, and then have our final comments.
So this talk was a perfect example. I never knew Sister Rashida, but from now onward, she's in our circle of prayers. So the sense of sisterhood is the main message that MWO is given. And as a healthcare professional, I just want to relay the message that as much as we appreciate the free coffee or a slice of pizza, we are all working and a paycheck is coming to our house. So instead of giving us a free slice of pizza or a coffee, I think donate to organizations like MWO to help with the work efforts to reach needy and people who are actually suffering or are in need.
Thank you, Sadia. That's a very good point. Dr. Dominique.
Hi. So I went to UCF and I lived in Orlando, 11 years ago or so. And that was when I met Rasha at a halakha. So I had graduated from undergraduate and then lived away from the area for many, many, many years, and then came back. And we just moved back about 7 months ago. And I went to my first MWO meeting 6 months ago, where my sister-in-law, Laura, brought me what I thought we were just going for a free brunch. But alhamdulillah, I got so much more than just brunch. I started getting involved with the Women's Health Task Force, and I've met those group of beautiful women, and I'm so happy to know them. And I just want to say congratulations real quick to Seema for choosing a medical school, FIU. I'm so happy for you. But alhamdulillah, the relationships with them, I'm just so happy to have moved back home and to be a part of the organization, and hope to get involved with the advocacy group and the converts group, because I'm a convert as well. So I'm really excited. My husband's like one group at a time since we're so busy, but alhamdulillah, it's really good.
That's wonderful. We're super excited to have you back in town and have you here and have you involved with the organization. Thank you so much, Dominique.
Thank you.
Thank you, guys. This has been amazing. I have one final question that I'd like you guys to share and we can reflect on. It's something we've reflected on a little bit already, but just, kind of to set us up for our next session, which is going to be next Tuesday on spirituality. I just want to get your thoughts on how Ramadan and spirituality have helped you cope personally during these uncertain times. We talked about it a little bit, with regards to how you're coping at work and how you're experiencing Ramadan, when within a challenging work environment. But I guess this question is from a little bit of a different perspective, is how has spirituality helped you personally and how has Ramadan helped you cope with this? And if it's a little bit similar, if your answer is a little overlaps, that's not an issue at all. But I want to pose that question, and we'll start with Rafat this time.
So during Ramadan, of course, like, that especially this Ramadan, like, I have been reading tafsir a lot, right? So with all this pandemic that has been going on before, of course, started way before Ramadan, there was a lot of anxiety. I was so overwhelmed, very concerned about the safety of my own family every day whenever I would come back from work. So I was just like, I had areas in my garage that I set up, like, that, of course, all the clothes and the shoes and everything would go in there. And I was very worried about bringing anything home, right? So I was very, very concerned, like, constantly concerned about the safety of my family at home, right? And but this Ramadan, I have been reading Quran with tafsir, right? It just like, this spirituality especially just like, helps me with my anxiety, makes me feel calm down, right? It's just like, just like, of course, like, as a Muslim, we do believe, like, all the hardships in the lives, all that, like, whatever comes is from Allah. So I find myself praying a lot, right? That Allah just like, that make it easier for all of us, right? That whoever is suffering just or like, ill with the disease, just like our dear sister Rashida's family, right? Allah just like, give them shifa kamil and then make them feel better. So I've been this praying a lot, and all this praying and all this like, it's really helping with my anxiety and that, like, and the other thing is like with all this, like, I feel like that I need to be involved more in community service. That's the reason I'm going out. I know it just like, especially when I go out and do all these COVID testing. So I like, my chances sometimes I like, especially sometimes my own family, they are concerned about me going out there in the field and do all these testing, right? But like, and they have been concerned about my health also. But like, I just like, I just want to do it. I just want to give back to my community. So I do these things, right? So give back to the community. So it's all tied up with all the spirituality, Ramadan. So yeah, that's about it.
Alhamdulillah. Thank you, Rafat. Annie, can you tell us how spirituality and Ramadan have helped you come through this?
So in Quran, it's stated twice that every hardship comes ease.
One of
So
my favorite
knowing
verses.
that, yes, and knowing that nothing is going to last forever, it helps me so much with how I treat my patient, and because I know that Allah subhanahu wa ta'ala is helping me in every step of the way. And trying to be support system for my friends, my family back home in Pakistan. So it's all about embracing the difference. And this is different life for us. And it could be our new normal, but it could be our new good normal. So, and I'm truly positive and truly hopeful that inshallah, with Allah's guidance and with everybody else work together, we are going to overcome this, and we'll see each other and we'll be able to hug each other.
Inshallah. And I'm such a hugger. That's probably been the hardest thing for me. I'm very touchy-feely, and I hug everyone. And for me, seeing my nieces and nephews and not hugging them has been, I'm happy that I get to see them, but for me, that's been a huge thing. Even my parents, I'm waving to my parents, which is not something that I have ever done. So that's, inshallah, thank you for those words of hope. Dr. Dominique, you can share with us.
Assalamu alaikum. I lost my thought in what you were saying because I agree with that so much. We had a really small graduation dinner last night for my sister-in-law. She graduated from law school, and we're so proud of her. And it was really hard not to kiss and hug people a lot more. And so, you know, as far as spirituality, it's something that's been a little bit more difficult this Ramadan, but I think that that's provided more reflection as well. And, you know, this would have been the first year that I would have been able to go to Taraweeh in a while. I did a fellowship last year and I was in residency before that, and I have 2 little kids. And so I was so excited about going to Taraweeh prayers for Ramadan. But unfortunately, that hasn't been able to happen. So I've just been trying to focus more on teaching the kids, you know, what is Ramadan and just very basic. So trying to help their spirituality as well, showing how, you know, Mama and Baba pray. And I mean, alhamdulillah, I'm so thankful to be home much more than I was last year. But it's definitely been a challenge for me and my family.
No, I absolutely, I feel you on the spirituality thing has been a challenge because that connection, I feel like, with the community brings a lot. And I know for me as well, personally, that's been hard, you know, not being able to go to the masjid, not being able to see the family. And it gives you, the solitude definitely gives you time to reflect, but I think that it's a change. It's something, it's very new for a lot of us. So I definitely echo your sentiments as well. Thank you. Dominique, how have you been able to cope? Can you guys hear me?
We lost you for a few minutes. Yeah.
Okay, sorry. Can you guys hear me now?
Yes.
Okay. Yes. So Rashida, so how have you been able to? How has Ramadan and spirituality helped you cope with the challenges of this pandemic?
I could tell you, I'm just looking forward to catching Laylatul Qadr.
Inshallah.
Inshallah, and inshallah we all do. You know, I just changed my focus around the intake, whether it's TV or there's no music, anything, just a more complete focus on Allah. Yeah, listening to lectures that really talk about the tafsir of the Quran, understanding Allah's word in the Quran a lot more, and having more time for that. So that has been an extreme focus of mine, to really dive into the Quran. For me, sometimes, you know, reading it is good, it's always good, but really understanding it and Allah's message in the surahs and everything that we're reading every day it has been my focus, and increasing salat.
Alhamdulillah, that's beautiful. Rashida, Sadia.
So I feel like I'm able to appreciate small things now in my life more than ever, like having able to take care of my kids and work every day. And, you know, the strength and the feeling that, you know, nothing is going to strike me against Allah's will. That feeling is very strong. And we cannot hug each other, but the word of kindness is very, you know, helpful these days. I'm just going to share a small experience. There was a patient in the hospital with prolonged hospitalization and had a really rough day when I saw him. I had been seeing him for several days. And after discussing the plan of care, I just, you know, he was very tearful and discouraged by the whole thing and slow recovery. I held his hand and I told him, you know, I'm fasting and I want to pray for you today, and I will, you know, for you to have quick recovery and you feel better. And the way he looked at me, with gratitude and surprise, and are you going to pray for me? And I told him, yes, I'm Muslim, and I'm fasting, and I will pray for you, and I really hope that you feel better. And he said that I've been in the hospital for too many times, but I've never, heard anything like this before, that a doctor said to a patient that, they're fasting and, they will pray for me. But I really appreciate if you do that for me. So I again feel like this is the least we can do, is to remember each other in prayers. And, the kind words have, amazing power of healing. And we should never forget that. We can still be amazing for each other, and we can heal each other and get through these difficult times. And as Annie said, that we are hoping for better times, and we know that we will be able to hug each other soon again.
Inshallah. Thank you, Sadia. That's a beautiful, beautiful story. Oh my gosh. I counted, there was five of us. All of us were crying. So thank you for that. It's that's very powerful, and I think that in college I took a class on health, public health and religion, and I remember one of those things that we talked about was that intersectionality of faith and healthcare. And whether or not you are an overly religious person, or you have a belief in God, or even if you don't believe in God, I think that people genuinely appreciate that when someone says that they're praying for them, right? It doesn't come from a bigoted place, like, I'm going to pray for you because, you need me to pray for you. But when it comes from a sincere place, like what you did with your patient, I think it's a beautiful thing. And, that look that that patient gave you, I can only imagine, the impact that you had on them. So that's amazing. That's a beautiful, beautiful story, Sadia. And thank you so much for sharing it with us. Rafat, can you share with us how, we started with you. So I think everybody has gone. Thank you, ladies, so much. This was a beautiful session. I was really nervous because I'm not, I don't always do this Facebook Live thing, but you guys made it so easy with all your wisdom and all the beautiful words that you shared, and the stories and the sincerity and just the raw emotion. I mean, it's a very emotional time, and I think that I really appreciate you guys sharing your vulnerabilities with us and with everybody who's tuning in. So I want to say thank you to each and every one of you guys. You are our frontline heroes. You're all out there making a huge impact in the community. And on behalf of the Muslim Women's Organization, I want to thank you for all the hard work that you're doing. I pray that you all stay safe and healthy, and that your families stay safe and healthy. And Rashida, we're going to pray for your brother-in-law and sister to come through this, inshallah. Thank you guys so much for your time. I do want to make one final appeal to anyone who's tuned in. Please, if you can support the work of the Muslim Women's Organization, now is the time to do it. With everything going on, we're not able to have fundraisers. We're not able to have those face-to-face meetings with people. So really all our fundraising is going to be going on virtually and going to be done online. So if you are able to support our work, if you've liked what you've seen here and what you saw in the previous session, please go to our website, www.mwo-orlando.org. Make a donation to help support our programming. Share with friends. Create a Facebook fundraiser for us. We appreciate the support, and we appreciate everyone's time. And thank you all for tuning in. Assalamu alaikum.
Thank you so much.